The new CDC study shows a sharp decline in cancer screenings for women due to the pandemic. And according to the CDC, breast cancer screenings were down 87%. Cervical cancer screenings were down 84% during April of 2020. While that was more than a year ago, some people have not kept up with the regular screening. So joining me now is Dr. Larry Norton with Memorial Sloan Kettering Cancer Center. He is a board-certified oncologist and the medical director of the Evelyn H. Lauder Breast Cancer Center. Dr. Norton, thank you so much for joining us on this important topic.
Pleasure for being here. Thank you.
All right. Well, let's just get right into it. Tell us how important it truly is to keep up with these regular checkups, because a lot of people think, you know, I'm just coming out of a pandemic. Give me some time. I've had a lot to deal with.
Yeah, you know, that's one of the great advances, really, of modern medicine is we found that for many cancers, and breast and cervical are very good examples, this early diagnosis is really critical. And it's not just to improve your chance of being cured, it's also to lower the requirements of therapy to get you cured. Less chemotherapy, less surgery, for example. And those are very important things for people to keep in mind. So that these precipitous drops in screening, especially in some populations that are already marginal in terms of health care access, is extremely disturbing.
And I think, too, you know, and we had talked about this briefly in the commercial break, about how when people do get that unfortunate diagnosis, they look back and go, oh, well, what if I would have caught it a little bit earlier? And that has a trickle-down effect.
Yeah, I mean, it's even people who do very well. In other words, they have the diagnosis and they get cured, but the thought haunts them for the rest of their lives. What if I caught it earlier? Would my chance of cure being greater? And of course, people who do relapse with these cancers, despite the therapy or of untreatable disease, are extremely troubled by this. The what if factor is a huge factor, and people have to think about that when they plan their own screenings.
Yeah, because it's not just you that you're affecting; it's your entire family if something happens to you.
Absolutely, absolutely.
So, what are you seeing in your clinical practice? Are people continuing to delay, or are you starting to see things bounce back a little bit?
They're bouncing back. My own institution, Memorial Sloan Kettering, has actually done very well because we've had very concerted outreach to people who've missed their screenings, to reach out to them, to call them back in and remind them they should get screened. But it's still down. It's not what it should be. And in some areas, other parts of the country and other parts of New York City, it's down 50%, where half the people who would normally get screened this time of year are not getting screened. So it really is very, very serious. And we're actually terrified that there'll be a tsunami of advanced breast cancer cases over the next few years because of this delay.
Oh, that is something we do not want to see. Okay, so let's get to the numbers when it comes to how long women should get their mammograms. What is that span of time in between mammogram?
Yeah, it's definitely a year. You know, and doing it more often is not more advantageous, and doing it less often is not as good. Now you're going to see very, very different guidelines coming from different organizations, and you see some of these presented every year. But we recommend at Memorial Sloan Kettering that you start at age 40 and you do it annually, and you keep going, because even in the older age groups where it may not save your life, it may save your breast, and it may require much less therapy to cure you. So yearly mammograms starting at age 40 is what we recommend at Memorial Sloan Kettering.
I got to tell you, some younger women watching this will say, wait a second, 40? I'm not even 40, and I've had some friends who've had breast cancer. So what do you suggest for folks who are younger?
Well, you know, there are some people who have a genetic predisposition to breast cancer, and so certainly if you have a family history, you should get checked to see if you're carrying an abnormal gene that may predispose you to breast cancer, and you should get screened earlier. These are individual decisions, and where the field is moving is called risk-adjusted screening. People who need more screening starting at an earlier age, and maybe even tests other than mammograms, like sonograms and MRIs, get those tests. We do think there may be some people who can actually get screened less, but we haven't found them yet, but we're looking for them. So this is an advancing area of science, but right now the recommendations that we have is start at age 40 and do it every year.
All right, and when it comes to cervical cancer?
Same thing. I think regular screening is critically important in this regard. You should follow the advice of your healthcare provider in this regard. There are some people who are predisposed to cervical cancer because they've had virus infections, as you see here. The HPV is a virus that predisposes to cervical cancer, and so the screening should be individualized for you depending upon your situation. And here too, I think it's very important for me to mention for both cervical cancer and for COVID, vaccination is really important. We cannot overemphasize the importance of vaccination. You could be vaccinated, especially at a young age, and decrease your chance of getting the virus that causes cervical cancer. And for COVID, it's critically important that we get the entire population vaccinated, so we have to stop worrying about this disease, COVID, and we can concentrate on other things, such as cancer screenings, because cancer is not going away just because of COVID. It's still there. And it's very important that we reduce our odds of having the infection that we can prevent with vaccination, so we can get back to the business of regular screening and prevent deaths from breast cancer too.
That is a very good point, because cancer is not going away just because we're in a pandemic. Dr. Norton, thank you so much for reminding us of how important these screenings are.
Thank you. Pleasure to be here.